Good evening and welcome to the show. Well, this week we'll be talking about rather a somber subject, a disease that's got people scared stiff around the world. It's a killer disease, it has no cure, and it's increasing geometrically, that is, double the original number each year. It's killing people around the world, mainly in the Western world, in the Third World and the developing world. We're just getting to know about it and how to prevent it. It's the disease AIDS, of course, and we have with us this evening, we're very glad to have with us Dr. Abdulla Al-Baker, head of the surgical department at Hamad Hospital. Dr. Al-Baker, welcome to the show. Nice to have you with us.
Thank you very much, Elias, for inviting me to this program.
In a nutshell, Doctor, I'm sure a lot of people know what AIDS is. In a nutshell, what is it? How did it begin? And how does it spread?
In actual fact, the AIDS is a syndrome of deficiency in the immunity, which has many pictures. And the problem of this disease, it is not only a medical problem. It is one of the largest public health problem and social problem and political problem, because it involves different sector of the communities and especially it involves the behavior of people. And the problem of the health always come when it comes to change the behavior of people. It is now agreed that it is caused by a virus which can infect the lymphocyte part of the white disease. And if we can have a look to the white blood cells as they are formed, they are composed of non-specific type of cells and specific type. These are the type which can give us the immunity. They have two types of cell. One is called T cell because it dependent on the thymus, and one is called B cell. This T cell is very important for the function of B cells. The T cell, when it is sensitized, it gives you 5 types of cell. One of them called helper cell, which is the most important one. One of them is called suppressor cell, which is also important because these two, they act on this B. One of them help it to produce globulins or gamma globulins or antibodies, and the other one stop it. So both of them, one is working on switching on and one is working on switching off of this. And the ratio between them is very important in the balance of immunity. Then we have this cytotoxic type, and we have one called lymphokine producing type, which really leads to producing of interleukin-2 and the others which help me. The virus, when it comes, which is called H, which is a human T lymphocyte virus, infects mainly the helper one and stays in it. So the helper cannot do anything to help the B lymphocyte, so the body will not be able to face any intruder organism or coming organism in the body. That's why it will lead to its failure and then in the end death of the organism. This is the origin of the disease. And this virus...
Well, excuse me for interrupting. What exactly is AIDS? Is it a disease that kills, or is it something that goes into the body and destroys the functions of the body to resist disease?
The AIDS is a syndrome which brings the virus to stop that lymphocyte of protecting us for any organism coming in. That's why the patients who die from acquired immune deficiency syndrome or AIDS, yes, they die from diseases of other systems. That's right. Because the body cannot fight even the smallest organism, or they may encourage to have cancer in the body, and the cancer will come and lead to their death.
All right. Well, let's start at the very beginning. Now, this virus just didn't happen. Where did it come from, and why in the last 5 years?
Yes. In actual fact, the studies have shown that the virus have been there. And maybe there was some studies published from Africa who have shown that this virus, in different form, not in that virulent form, which we have now, have been in Central Africa somewhere. But recently, the virus have become very virulent and have involved this immune system because there is many ways for this virus to spread. And it seems the wrong sexual behavior, which is present in the modern life, was one of the most important reasons of the spreading and the virulence of this virus. And following majority of the studies, how the virus come to America or to Western world first, it seems that originally these people who contacted the disease, either they have been in somewhere in the central area of Africa or nearby area like Haiti's, or they have been, somebody from these countries have been there and have gone through homosexual behavior with the other and infected them with the disease.
Yes, but why in the last 5 years? Why didn't it show up before?
Yeah. Now, actually, this
I
is...
mean, homosexuality has been around for years. I mean,
Yes.
why recently?
Yes, and there is no definite question as far as scientific people is concerned, but they would think that that the disease have spread because the homosexuality in open countries and free countries have been abused and used in a large scale, and especially the homosexual. They are now even having different partners and multiple partners than used before.
Very promiscuous.
And that's why there's now the spread of the disease. But in actual fact, there is no exact answer why it is really that virulent have reached.
Yeah. Now, let's get down to the point of how you catch this disease. Before you tell us how you catch this disease, I bring to your notice a couple of instances that happened in the United States last month where school kids who had AIDS, of course not through sexual behavior, but through blood that had the virus, were taken to a school and parents of other children kept their kids away. Is there any justification for this?
The information available now in our hands that the virus spread through wet medium.
Through a wet medium?
Wet medium.
Yes.
It means semen,
Yes.
blood,
Yes.
and it is present in the tear and urine, but there is no evidence at the moment that the tears or urine can be a leading way of transmission or a medium can transmit through.
What about saliva?
That's to say that if there is no direct contact, that's to say sexual intercourse or injection with a needle or taking a blood, there will not be a infection by the virus. That means normal contact with people, sitting with them on a chair or going with them or socializing with them is not a way to transmit the disease. This is to tell the people not to worry and to say that anybody will be infected by a virus.
So it's not transmitted that easily?
No, it is not socially transmitted. Even the ladies who got the disease, when they went into their history, they find them either they have been in contact with people who have been infected or they have the disease itself. And it is not. And the children who are getting this from their mother, they are getting this either through the placenta, or they are getting this now. They think it is through the milk in the breast of the lady.
So a young child who goes to school and has AIDS through contaminated blood transfusion, he is totally safe to his classmates?
He is safe to an extent that if there is no blood or blood products available to go into any other person through a wound or a prick or a needle or whatever the sign.
So if this child who has AIDS gets cut and he's taken to the school infirmary and he's fixed up, and by some way the nurse gets pricked in the finger and gets his blood into her blood, that she catches it, right?
Yeah, up till now there is no evidence also about this, but there was a recorded case of a nurse who catch AIDS through a prick of a needle.
Yes.
There was one case reported until now.
Yes.
But up till now, even if there is no evidence that really this prick was the cause, because the prick of the needle, which we get from the needle, is actually very small, and the amount of a virus goes into the body will be neutralized. No doubt about it.
Yes.
But in the same time, if there is a big or multiple pricks and there is infected materials of an AIDS person, there is a danger or a chance that somebody will get this.
So basically, it's transmitted through semen, maybe through urine, saliva?
Saliva, it is there, but there is until now, there is no proof. That's what they say. They advise not to have the prolonged kiss, which can mix saliva with each other. Otherwise, there is no scientific proof up till now in our hands that saliva can
So
transmit.
basically, it's transmitted through a liquid medium.
Yes.
Right. Now, when we talk about AIDS, what about the third world, the developing world? What should they do to make sure that this doesn't reach their shores?
Yes. In actual fact, AIDS is a preventable disease. And the prevention comes by knowing the people at risk factor, as risk factor for us. Now, risk factor number one, which is known, are homosexuals. And if we look to the diagram, we can see this is taken from July statistics from America.
Yes.
And can show that homosexual comprise about 78% of the cases. This was July, when was about 11,132 cases.
Yes.
By August, end of August, the publication was about 12,700. That means there is always increase.
Let me go back. This is in the United States?
Yes, in the United States.
Which month is this?
This is July 1985.
Okay, so this is just a couple of months back.
Couple of months back.
All
and
right.
you can see that the homosexuals and bisexuals are heading the list.
Yes.
Then come the drug abusers or users or the intravenous ones.
Yes.
And you can see that the females is sharing in this.
Well, it's because through the needle, right?
Yes.
Yeah.
And then the others comprise. That means for the illegal acts or the hidden acts, you can have a 92% of the cases. And this is the problem. In European countries and in Western countries, the organization of homosexuals are known, and there is some people are even known. They can come and introduce themselves to the authorities, and they may go after advice. But the problem in the developing countries, there will be difficulty to find these people, to know these people, and there is no exact study where is these people scattered. And this is also one of the problems which will make us frightened that this disease may, if it comes to the developing countries, will spread in a fast way.
There is one thing that I want to bring up here. The cases of AIDS is increasing at an alarming rate. Is that right?
And there is also statistics. You can see how it increased in America. There is a map which can show America by states.
All right, we'll have that slide in a moment. Firstly, Abdullah, could we have number one slide? And this is basically the...
this is basically the mechanism of immunity. As you can see, the antibodies come to the recognized by the macrophages and the T cells.
Yes.
And the T cells, they produce the types of them. Which one of them is the helper? Helper induce the B cell to give antibodies against the new antigen and destroy it.
So it's the helper T cells that are really...
You see the other slide.
Yeah.
You will see that the T cell...
Yeah, slide number 2, please.
You will see that the T cell is getting infected by the virus. And up till now, there is no reason known why the virus can really escape the detection of the macrophages and the T cells and go to the helper directly, which infect it, and after this will lead to... This is the map of the America showing the states in different, and you will see in this, if I can have it here, in California, which is the increase is horrible. This is the showing between August 83 to July 85. In 2 years' time, the number, see the number, and thousands increase in California and in the New York area. And you will see that once you go inside America or higher up, it's less and less. There is 3 or 4 states still with zero, but we don't know the future, how it will happen. This is spreading fast, and it's known. If you see 2,000 in 2 years' time happening, 2,000 cases means at least 2,000 time increase, and we know that the victims of this disease have survival of 50% at the moment for 2 years, and nobody at the moment since 1981 have proved that he lived at this time. And this is a long time, even infection. Anybody will catch this disease or the virus, even if he is not showing the signs of the syndrome, of the signs of the disease, he will be having this virus or an antibodies for it forever in his body.
Yes. So it does take quite a while for the AIDS virus to show in the body.
Yes, there is something called the latent period. That's why this latent period of the virus, it ranks between let's say 8 months and 5.5 years. But in children and infants, it is between 2 months and 5.5 years, because children, especially in the first 2 months, suppose an infant get this from an infected mother or a mother who has infected partner, he will get the disease immediately, because children usually, they are deficient in their immunity between the first 6 months. And that's why they get very quickly. And it's very severe type of disease. But there is some children who got it after 5.5 years of infection of their mother or of getting blood from donors.
So it's a sleeper disease, really.
Yeah.
It can
That's
be
why now, according to the latent period, many scientists are thinking that this virus cannot be alone. There must be helping factors or cofactors to help this virus. And they are producing or saying different theories or hypotheses about this. Some of them, they said, maybe it has neurotic origin, that the virus come, infecting the nervous system goes to the central nerve, then divides into the body. Some others say different hypotheses. That's why there is a latent period. And the problem which we are facing now, and still science is facing, that we cannot predict after the infection of the virus who is going to go to the something called the full-blown picture syndrome. Because we have now different picture. In the infection of the virus, we have different categories of diseases. Number one is the full-blown picture. This must be satisfy the criteria which is defined by the CDC, which is Center of Disease Control in America. That means this is a disease or infection by the virus which it must be accompanied by infection by opportunist organism. Mainly it is what is happening in the chest, which is called pneumocystitis cranii pneumonia, or have type of sarcoma which is called Kaposi sarcoma.
Yes. Yeah.
And this is the full-blown picture. And this goes to 2 to 10% of the infected people. Then the rest of the people have the AIDS-related complexes, which we have to advise people, and the people at risk, which we'll talk about them later. The people at risk, who are the homosexual and bisexuals, who are the drug abusers.
Why? Because
People,
they use
yeah,
the same infected
same needles,
needle.
of course,
Yeah.
because they see the same needle. Although now there is in the world, there is many needles who are really sterile. And the people who are partners of homosexuals or partner of the infected people, the homophiliacs, because they are getting the factors which can really help them in having their factors corrected, and people who get blood or blood products. Blood products means blood products means red blood, platelets, or white blood taken. This is an example of one of the sarcoma called Kaposi sarcoma. This is the old type of Kaposi sarcoma, which must happen or present to diagnose the full-blown picture of it. Then the importance come. This is also showing a thrush in the mouth of one of the AIDS people. So this is caused by monilial or type of fungus infection.
Do all AIDS patients have this thrush in the mouth?
Not all, some of them, because this is opportunistic type of organism which infect them.
And this helps transmit the disease? Would it help transmit the
Not
disease?
from this.
I see.
Not from this one. Through also another contact, through the risky people, as we said about them. These are the risky people. We can see them here.
So to sum up, we have homosexual or bisexual men, IV drug abusers, intravenous, right?
Yeah, about Haitians.
What is this big mystery about Haitians?
There is. They find that the majority of the people who are infected first in California, especially in New York, in 1981, they have Haitian connection. Either have been tourists or they have Haitian origin, and they find that Haitian have this also. At the same time, they talk about Africa as an origin for this. Now CDC or the Center for Disease Control have removed Haitians from the list. But for me, I would be cautious about this removal.
Yes.
In actual fact, this could be a touristic thing, because when they put Haitians, it affected tourism in Haiti. But still, there is some sort of relation between these people living in these countries and the disease. And this is also in children. And as you can see that there is no specific therapy at the moment. Up till now, there is many trials to treat this disease. Number one, by antiviral type of drugs. And number two, by using immunotherapy, which is either in the form of transplantation of bone marrow or lymphocyte from normal person, or by giving these types of secretions which come from the lymphocyte, which is the interleukin, or giving the interferon, which is sort of a protein produced in the body by the effect of the virus on the normal cell in the body. But up till now, there is no successful treatment. At the same time, they are trying to treat the complication, which is complication of the chest, But at the moment, although there is drugs can halt the disease
Yes.
or can stop regression of the disease or complication, but once you stop this drug, the disease will come back.
So prevention, to sum up, doctor.
Yeah, prevention is important, as I said, is number one, is to educate people
To change the
that to
lifestyle.
change their lifestyle
Yes.
and their behavior.
Yes.
And important is the homosexuality,
Yes.
no doubt about it.
Yes.
Number two is to instruct people to avoid having sexual intercourse, or even a wife, if an infected husband or homophilic husband who have antibodies, or homosexual one who have antibodies, to avoid doing sexual intercourse with them, or avoid in the same time getting pregnant, because this will lead to giving the new generation or the
cycle,
child the disease.
And the second
At the same time, of course, to avoid drug abuse,
Yes.
which is a very difficult problem
Yes.
now all over the world, because there is many people becoming rich on its when it works for them.
Yes.
And at the same time, if we cannot do this, we have to educate these people to use safer needles. Shame to say this, but it
Yes,
should.
yes. Well, let me talk about Hamad Hospital and its role in all of this, Doctor. Now, you're head of the surgical department there, right? If someone, God forbid, thinks he has or she has AIDS, what should they do? Should they get in touch with the hospital?
Yeah, Hamad Hospital.
Do you have some sort of way of knowing whether they have AIDS?
Yeah, Hamad Hospital is now putting a strategy or a policy. Since there is no single case reported in Qatar, or we haven't seen, number one is to look into the problem of the blood donation.
Yes. Now,
For this reason, they have already ordered the test machines which can test for the presence of antibody. Of course, we are not late. If some people think late, we are not late.
Well, let me-
because this machine, like the one which called Elias, is already introduced into England just only last month, in
Yes,
October.
yes.
So we are not late. We are getting it now to be sure about our blood donation, and in the same time, be sure about the blood which have been coming to us from different countries, and this is very important. And then the people who think that they are risk factor,
Yes.
we invite them to come
Yes.
and have this checked to be sure that they are not catching the disease, so they cannot,
But it's-
and they infect the community.
it's very difficult for somebody to come forward and say, look, I might have AIDS, could you check me?
No, this is very
What
important.
are the symptoms of AIDS?
Yeah. Important is to know, number one is the person one of the risk factor or not? We have
Yes.
said the risk
All right.
factor.
Well, he
and
would-
these people, they know themselves.
They know themselves.
And it's sure these people, they will not come tell you I am homosexual, no.
Yes.
But it is now anticipated.
Yes.
But because of this is available,
What about-
these people will come by any way.
What about physical symptoms, doctor?
Yeah, the physical symptom. There is now, the full-blown AIDS syndrome is too late.
Yes.
But there is physical symptoms which people have to know about them, which is called the AIDS-related complex.
Yes.
This, number one, is lethargy or weakness,
Uh-huh.
loss of weight without any reason,
Yes.
and chronic diarrhea means people always having
Yes.
loose stool and
Yes.
without any reason,
Yes.
and having anemia also,
Fever?
fever, one
Yes.
of them,
Yes.
and general malaise in the
Yes.
whole body. This is
Yes.
the main prodromal. Of course, other
Yes.
thing in the laboratory we can investigate.
Yes.
Or, of course, important to have lymphadenopathy.
Yes.
Lymphadenopathy is defined that if you have more than 2 lymph groups all over the body,
Yes.
not the inguinal one, because
Yeah.
the inguinal usually, because in our life we usually have scratch in our feet or in our legs, so you get them sometimes enlarged. We cannot depend on them. If you have more than 2 lymph glands enlarged somewhere in the body, so this lymphadenopathy, and we shouldn't hesitate to
So
go
even if
and see physicians.
if a person has these symptoms and is not a member of the high-risk group and is not a hemophiliac and is not a drug abuser, then it probably doesn't have AIDS.
No, he should have go.
He should
He
go.
should go because now there is some reports, although few cases happens in heterosexual people. And because of this,
It's
maybe there is something. Of course, if somebody knows about himself that he's not all.
But it's begun to spread to heterosexuals
Yes,
now.
yes.
Yeah.
But the number is not much high, that one. That's why
Yeah.
we are not frightening of the normal people.
Yeah.
That's why I can say it's preventable if we can really reach this risk factor people.
What about, let me go back to Hamad Hospital again. Now, we get most of our blood from overseas, is that right?
Yes.
From the United States?
Yes, true.
Now, are you testing all this blood before you give it to patients?
Sure. After getting this
Yeah.
machine, we will be testing this, and sure there will be a policy, will be published by Hamad Hospital Public Relation to tell people what to do, and we don't want people to panic.
Yes. Yes.
Because if they are not risk factor,
Yes.
it's rarely they will get the disease. No
Yes.
way they get the disease.
Yes, but we want people to go into Hamad Hospital for a transfusion of themselves or their children and have their mind at rest, really.
Yes, sure.
Not to think that this blood is
Sure.
contaminated. And of course you can assure them of this.
Sure, no doubt about it.
Right. Just to conclude, Doctor, what about this disease or the virus being spread, for instance, in swimming pools? We've heard that swimming pools may have this. What do you have to say?
As I said, that of course, number one, precaution is very important
Yeah.
for a person who don't want himself to be infected. But up till now, there is no proof that swimming pool is a source of infection. There is no paper published about this. But no doubt there is suspicion about jacuzzis.
Jacuzzi.
Yeah, because usually known in European areas or some other areas, especially even in the Far East, that these homosexual, they always prefer to prepare themselves and their beauty. They go to jacuzzis first.
Yes.
And maybe they do some sexual work there, and it happens that cases published through the jacuzzis, not because of the water there and because of the act itself.
Yes.
But there is no doubt that somebody thinks that jacuzzis have a place in the transmission of the disease.
Yes. Well, it's all very interesting. It's a terrible disease. What are your feelings? Will they find some sort of cure for it?
I believe that although at the moment there is no cure, and although all the scientific research and work are concentrating on two strategies, because they think the third is very difficult. As I said, changing human behavior is like swimming against the currents.
Yes, yes.
And they're concentrating on finding vaccines or treatment for the virus. I would believe with the tremendous effort scientists are putting in the world, with the encouragement of governments and organizations and WHO, with good resources they have, they will be able in the, I would say, near future to find the drug which can at least prevent spreading of the disease in the rest of the community.
So the old saying, prevention is better than cure,
Sure.
really applies in this case,
Sure,
doesn't it? If there are some people out there who want to ask about AIDS, is there a number they can call? Can they call you, for instance?
Anytime in the
Yes.
hospital.
And at your number is 32?
321770,
Yes.
extension 174.
Okay, and there we have it, ladies and gentlemen. Dr. Abdulla Al-Baker speaking to us here on Be My Guest on the subject of AIDS. We hope to have Dr. Al-Baker with us again in the very near future to speak about various subjects, including smoking, including age extension, and many other subjects that he is an expert on. Thank you,
Thank you
Dr.
very much,
Al-Baker.
yes.
And thank you at home for watching. See you next week. Good night.